Hi, Lynette. Thanks so much for spending time with us today and showing us around this new endoscopy suite. So we're really excited to get started. But before we do, I'd love for our viewers who haven't met you yet to get to know you a little bit. So tell me about your background and your experiences.
I've been a nurse for 17 years. The last 7 of those years have been with Novant, right out here at the hospital at Brunswick. Have a critical care background, surgical services background, and recently was the manager of the med-surg department. So when the position came open here, I thought it would be a wonderful experience to kind of meld all my things
Bring
together.
it all together.
Yes.
Well, we're really excited to see the center today. Can you tell me a little bit about what we're seeing right here and talk to me about the patient's experience?
Okay. The patients would come in the front there. After they register, they'll come through that door. This is the main nurses station. So they'll be escorted around this way. And if you want to walk right over here, I'll show you the pre-post rooms. We have 14 pre-post rooms.
Okay.
They start and end in the same room.
Oh, sort of like at the hospital when they're getting ready for surgery.
That way the family can stay in here and wait on their family member. They don't have to take belongings or anything and go anywhere with them. So they'll start here. The nurses will come in, take vital signs, put the IV in. The CRNA will come in and talk to them, and the doctor will also come in and talk to them in this room.
And the visitors will be here with the patient?
Yes. Yes.
Okay.
They will stay in this room.
All right, great. Well, it looks like a very comfortable room. There's a bathroom here?
Yes. It's a bathroom, and all of our rooms are set up exactly the same.
Great. So what are your hours here at the endoscopy center?
7 to 3, Monday through Friday.
Great. Is a physician's referral necessary to have the scope done here?
No, it is not necessary. They do need to see one of our specialists, which would be one of the GI docs or one of the surgical associates docs.
That was my next question. I wondered if patients always need to be seen in the physician's office prior to having their procedure here at the endoscopy center.
They do not need a referral, so they do not need to go through their primary care physician, even though sometimes that's where the conversation starts. When you turn 50 years old and they say it's about time to get this screening, it may start there, but they don't have to have a referral.
So Lynette, what happens next? Kind of walk us through what the patient would experience from here into the procedure room.
Okay, so when the patient is ready and the team is ready, we will roll the patient out. The family is going to stay here in the room, or they can go back out to the waiting room if they choose to do that.
Okay.
We do ask that they stay on site.
Oh, of course.
So they'll be rolled this way. Before we go into the procedure room, I would like to show you some behind the scenes.
Oh, that'd be great. I like the behind the scenes stuff.
This is our reprocessing room.
Wow, what in the world?
We're very proud of this room. This is where the scopes are reprocessed. This is state-of-the-art Advantage Plus Medivators. So the scopes have serial numbers. They have a scanner. The employee scans themselves. They scan the scope. It pops up with the patient's name. It pops up with the doctor's name. So we can do tracking for infection prevention reasons. There's 2 machines, and so she can process 2 scopes at the same time. When she gets through processing, then she will hang the scope in the pass-through cabinet. She'll get several of those in there, and then she'll walk around and go to the other side and put them in the clean scope cabinet. These areas are separated. This area needs a negative pressure.
Oh, I see.
Because this is going to be the decontamination room. So you want to keep everything in here.
Extremely clean.
Yes, extremely clean. And that's the reason we have the pass-through. And then the air pressure on the other side of the pass-through is positive pressure. And that's where we keep the clean scopes. They're kept in locked cabinets after they're processed.
I noticed there's a lot of piping on the walls and what have you. Can you talk to me a little bit about that?
I sure can. The water has to be a certain temperature, so you've got your hot and cold water mixing to get to the correct temperature, and it has to be a certain pressure when it comes through the medivator, so you have the pressure gauges there that are constantly reading the pressures.
So all of this is similar to what happens in the hospital in terms of the infection prevention and things like that.
Exactly.
So it's similar to that. Well, that's great. Well, this is those things look amazing. They're so big and new and pretty.
They really are, and the staff that has been trained to run this equipment, they're so excited about it. They've received a lot of certifications, and so they're
Good.
ready to go.
Good, great. So, where do we go next?
Okay, well, let's go to the procedure room.
Okay.
So this is where you come to actually get your procedure.